Let me tell you about our recent work, PseudoSegRT. PseudoSegRT is a method for efficient pseudo-labeling for intraoperative OCT segmentation. We presented this work in the 2013 International Conference on Information Processing in Computer-Assisted Intervention. Various retinal diseases, including age-related macular degeneration, leads towards blindness. Sub-retinal drug delivery using surgery is used for treating such conditions, where this procedure requires microscale maneuver and precise manipulation of delicate tissues, which comes with the risk of tissue damage and inflammation. It also requires blood formation in which the drug is delivered. This comes with the risk of retinal detachment. Intraoperative optical coherence tomography, or IOCT, is used during these surgeries to provide visualization to the surgeons. However, IOCT setup is very complex. It requires seeing through surgical and IOCT imaging feed, and it requires training and expertise for interpreting such images. Moreover, these IOCT images are affected by motion artifacts and speckle noise, making it difficult to see different layers in the intraoperative settings. Intraoperative OCT segmentation can provide better guidance and visualization to the surgeon during these procedures. However, it comes with its own challenges, as for training these models, we require large number of annotated data. Moreover, these methods need to be implemented in real time for high resolution OCT segmentation, and they must incorporate interpatient variabilities and robustness to these kind of variabilities. To overcome these challenges, we proposed an efficient pseudo-labeling method for OCT segmentation that requires very limited amount of training data for learning the segmentation layers. The method uses a dynamic pseudo-labeling loss, and it is implemented in real time for easier translation into the clinical settings. The method consists of two phases. The first phase is fully supervised learning phase, in which very limited label examples are used for training a segmentation model until satisfactory performance is achieved. Once we have this trained model, we then move on to the pseudo-labeling stage. In the second stage, the trained model is used for predicting on unlabeled data and then through thresholding, obtaining the pseudo-labels. Pseudo-label data coupled with the label data is fed into the segmentation model, and we continue to train this model using a dynamic pseudo-label loss function. Through this loss function, we continue to update the pseudo-labels while the model is getting trained and until we achieve the convergence. The method consists of two loss functions. First is applied on the label data and referred as fully supervised learning loss, while the second loss is applied on the pseudo-label data and is referred as dynamic pseudo-labeling loss. In the dynamic pseudo-labeling loss, we have an alpha parameter. This is the pseudo-label influence controller. So if there are more low confidence pixels in an image, the pseudo-label influence will become higher. By combining these two loss functions, we get the combined loss. For the evaluation of our method, we use the publicly available SMOS dataset in our experiments. We trained our model on healthy scans dataset, and we kept a separate holdout healthy and unhealthy scans dataset for the model evaluation. We Also translated our algorithm into TensorRT and found that we can achieve a frame rate of about 1400, making it real time for clinical translation. Our experiments, we compare the method with existing pseudo-labeling methods, where we only used very limited amount of samples for training and an equal amount of examples for creating pseudo-labels. Through these results, we can see that the model generalizes very well, both in the case of healthy and unhealthy scans, while it outperforms in the case of unhealthy scans, where the distribution is very different as that of the training data. In the case of these unhealthy scans, the existing methods, state-of-the-art methods, they are not able to perform very well, while we managed to achieve a performance of about 89%. It was a quick overview of our work. If you want to find out more about this work, check out our paper by scanning this QR code, or I have also left the link to our paper in the description. Thank you.